Welcome back. Awareness of mental health has been rising over the years, yet people struggling with their mental health continue to fall through the cracks. Is the system failing those in need? What role can spirituality and community play in helping people struggling with mental health? To discuss this, we are joined again by Dr. Fariha Khan and Yaseen Poonah. Fariha is a family physician based out of Brampton. Yaseen is the co-founder and executive director of Naseeha, the Muslim Youth Helpline. Let's hear their advice on how to tackle mental health challenges. Fariha, Yaseen, thank you so much and welcome back once again.
It's good to be back.
Thank you.
Perfect. So I want to talk about some of the solutions when it comes to mental health, and I want to frame the discussion. Earlier on, I think around in February, there was a case of a student who went on a stabbing spree, unfortunately, in Pickering at a high school. And as I was following the article and the story, there were Globe and Mail and City TV. They were talking about how this girl, she did have a history over a couple of years of suicidal intentions, depression, and they had taken her to hospitals, and the hospitals kind of just turned them back. And so when they interviewed, I think the stepmom, she actually mentioned that when she got the call, she kind of knew this was going to happen. So I guess that obviously there's a lot to take in with that story, but how do we navigate through a system that it seems, unfortunately, and this is not the only case, where it's pretty much set up to fail people? Like, how do we even begin to figure this one out? No pressure.
At least in our at least in our case, based on some of the call logs that we get, a lot of the issues that we get are secluded issues that nobody else kind of knows about. And after the fact, a whole box of worms comes out and we're like, yeah, we knew about this, we had an idea. And some of the times, like going back to our last episode, we talked about how it's, mental health is a fad and not in a fad out of context, but it's a really good brand awareness. And sometimes we got to take the positives in that to kind of encourage, these patients or these people who have these depression issues, that they're not alone. And at Naseeha, like thank God, over the past year, 2015 has been very overwhelming in a good way, that we've been really participating with schools. I mean, some of these
public schools,
with public schools, with private schools. We were actually working with Toronto and Peel District, and in fact, we just got reached out to the Catholic Board.
Oh, wow,
so this is a good thing, because what's happening is, just with the whole curriculum that came out in last September, I mean, these are things that we need to accept as a community. And what we did was, how we brought in all the teachers throughout all these schools, and how do we adapt to it? How do we adapt this curriculum to the students so that they don't feel isolated, they don't feel secluded, and they can kind of engage, whether they're talking to their peers or they're talking to their guidance counselors if they have one, and so forth. So going back, we're actually being more engaged in assemblies. We're making campaigns that they're more aware of, such issues, that if they feel depression, the biggest thing in my mandate is to have that open conversation, because sometimes I feel that, our mindset
have an open conversation with anybody as a first step?
I mean, having an open conversation with everybody is a start. I wouldn't say just anyone, because sometimes, with the wrong individuals, just like anything else, you can actually go in the wrong direction.
So I just want to pause you there and ask. So in the story that we were seeing, right, the mother said that this student, they did try to seek help. So, she may, obviously it sounds like the family knew what was going on. They took her to a medical institution. They didn't do anything. So it's like, if we say, don't mean to put it all on you guys, but where do we start?
I mean, I guess I look at cases of mental health, and you try to kind of box them, stratify them a little bit into what is, for me, I look at it as who is imminently at immediate risk versus who has sort of an ongoing issue that they sort of need ongoing coping skills, but they're going to do okay. Their quality of life could be a little bit better. With them, we can sort of manage them through the family practice, and we have an ongoing relationship. So that's a little bit of a different story. The kind of case that you're talking about, where there was actual risk to that individual or to the broader community or to another individual, those need to be taken a little more seriously, and you need to get on that right away. The challenge is when you have a child like that or an adolescent like that who is having these thoughts of harming somebody else. And I've been in this situation with patients where...
And it's not just limited to adolescents,
Not just adolescents, yeah. So it could be an adult. So we're talking about usually things self-harm or harm to others, or a real inability to care for yourself or care for a child, right? So those are sort of the 4 big categories where we really need to intervene quickly. In my experience, you can go through sort of these sort of urgent care routes of referral to a local hospital. That can sometimes still take 2 to 4 weeks, if not longer. For more imminent pressing concerns, there's the emergency department. The trouble with that is that sometimes if there's obvious risk, like this person is at obvious imminent risk of doing harm to self or others, the police can get involved, and the individual can be kept in hospital, sort of, they call it a Form 1, against their will, but to be further assessed. And that happens. The trouble is when you have somebody who has ongoing thoughts, they don't seem obviously at risk of doing harm right then and there. What do you do with them? You can't keep them against their will in the hospital. There's not enough evidence to say that this person is at risk as soon as they walk out the door and something bad happens. But at some point when these situations happen, that line got crossed, right? That person now crossed that line and did do the very thing that they were worried about. And that's where I find we really do struggle, is that sort of in between highly at-risk individual. And I don't know, I wish I had a better answer. I think we're still trying to figure that out. I think for me, I would say to people, you've got to have that conversation. You need to have that conversation with a professional that you feel comfortable with, or with something like Naseeha, just to get the ball rolling. Because some young people, if they don't feel like they can turn to their teachers or their parents as these authority figures that have expectations of them, where do they go? So it's nice for them to have an organization like Naseeha, an outlet to kind of say, okay, where do I begin?
And Yaseen, with your organization, how do you have trained counselors, obviously, that are dealing with these cases. What sort of, depending on the case and the level, what sort of resources and support systems do you have that you refer them to if need be?
Good question. So primarily what we do is just in-house. We have monthly, actually every 6 weeks we actually have in-house training. So we either bring in doctors, psychiatrists, or professional third-party people that come in. In fact, our last training was with Living Works with Suicide Assist. So giving these professionals coming in and talking to our counselors on how to engage topics that will escalate into suicide. We also have something called SLC, which is second line contacts. The thing with Naseeha, it's not just locally based, it's internationally based, Canada and the US. So sometimes we got to make sure that we create alliances with these professionals, because if we get a call from Seattle, there's no point in referring them to somebody in Canada, for example. So we've got to make sure that we create these alliances. What we also do is sometimes these callers call us for the very first time, and it takes a lot of trust and courage for them to kind of say these things that they possibly never mentioned to anyone before. So what we do is we actually have a call log and with a case number, and we kind of ensure them that, we're taking these logs, nothing personally is ever being recorded, but to make things at ease, and when they agree that, there's a big relief off of my chest, I feel a bit better, but yeah, you know what, you're right, I think I'd like to see a doctor, but don't let go of my hand. How can you kind of give me this handshake? So what we'll do is, with their permission, we'll take our call log, and if we have a second line alliance in Seattle, for example, we'll go ahead with their permission to say, okay, listen, we're going to make the arrangement, we're going to fax them or email them the log that you've kind of expressed to us, so they have an idea, they have a diagnosis as to what to expect, so that when you're going in for the very first time, you don't feel like you're cold calling them. You don't feel like you need to explain everything. We already are showing partnership, and most importantly, when they hang up their phone, they feel a sense that, you know what, the ball is rolling, I have a support system in place. And 7 out of 10 times, I feel that having someone to just hear them out, and the second part is help, a support group, that already probably takes 50% of their load, that they feel better already.
How do we raise awareness so that you can actually have that conversation? 2 years ago, I actually had a friend, and she was going through, something that totally wasn't related to depression or suicide. And after speaking to her, it turned out she, had tried to commit suicide. She was really depressed, clinically depressed. And then, I connected her with the right resources. But how do you, and she only told I think a handful of people, 2 to be exact. And it's sort of, how do you make it okay to talk about it?
Well, I think from a health professional standpoint, for myself, I make mental health part of overall global health, right? It's not, people come in for their physical, we ask them, head to toe, are there any issues going on? And part of that is the the unseen part, right, is the mental health component. So there's always I'm asking my patients, do they smoke, do they do drugs, alcohol, those are, and people will be really quite honest when you ask, when they feel like they're in an environment that is safe and that you're asking with good reason. Because if there is something that is identified that needs to be addressed, you're with somebody who's there to do that. So part of that too, I will ask, are things going well at work? Are things going well at school? Do you have any concerns about your mood? Do you have any thoughts that are concerning you? So we'll address all of that in a visit. And so part of it is awareness is from the organizational point of view, from places that exist, like Naseeha, to know that Naseeha exists, to know that these places are out there that you can call. But I think from the health professional perspective, I mean, we all have a responsibility to create that awareness one-on-one. It's not just about billboards and phone numbers that you can address and websites that you can go to. It's letting people know that as your healthcare provider, and that's something that I take seriously, is that's part of my understanding of health for you.
What about people who post things on social media as an outlet?
That's a tricky one. So actually, it's interesting to bring up the social media, because I actually have this discussion with every one of my depressed patients or anxious patients, but especially with depression. I will ask them if they're on social media, and I get a sense of how that impacts them, because it's shocking actually how people get on to Facebook or Twitter. I'm not that into social. I'm only on Facebook.
Me too.
And they compare themselves, right? So we used to have this society where we compared ourselves to Hollywood stars and Bollywood stars, if that's your thing, and supermodels, whatever the case may be. But now people are comparing themselves to their friends, their colleagues, their own siblings, who by and large put their best face forward on Facebook, and it's hard to have that comparison, right?
One of my pet peeves, and only because I know what maybe some people don't as far as the Naseeha is concerned, but we have a lot of calls on eating disorders. And on social media, the biggest thing is food porn, if you will. They'll take a picture of their food, whether, I don't think there's anything to say, hey, this is only 100 calories, but just the fact that they're doing this, you never know what the next person, let alone a diet, but somebody who might not have enough for their plate that next day. So it's just so much, you're exposing yourself in such a great exposure that you don't know who in reality with social media, you don't know who your audience is. You might think that you're sharing it with your 6 friends, but then when you start sharing it, it becomes a calamity at the end. But one of the things about thing is we got to engage this conversation as if it's a cool thing, but it all comes down to the real stigma behind it is the fact that, number one, nobody likes to be judged, and number two, families sometimes like to hide these stigmas, that it doesn't exist, let alone in our community, but in our house, that I'm a professional, I'm an entrepreneur, we have 2 beautiful cars outside, I can't afford to show the community that I have a disabled child with depression or some bipolar disorder, so we'll just hide everything. Or the fact that as the individual, I already get heat from my parents, now I'm gonna go to a stranger, what will they know? So we need to kind of break these barriers to kind of say, first of all, it's okay, it happens in every community. And there's, in Canada primarily, there's just so many social services out there, so much support that, not everyone is created equal, so same with every organization. Mental health is so broad, but it's a work in progress. You're not gonna get that right organization on the get-go, but let's all work together. And that's one thing I like about our communities. We form these alliances. Like, look at today, we have 3 great organizations working together to promote dialogue, to engage in conversation about mental health, and making people know that it exists and it's okay to talk about it and seek help.
What if you guys could give 2 pieces of advice, one to someone who's watching who may have a family friend or member in their community who they know is going through mental health issue, what would you say to them? And the second one is, if there's someone watching who's either going through an issue right now or just haven't mustered up the courage to talk about it.
To be honest, for both those groups, my one piece of advice always, and I remind my patients of this, is that you are your own best advocate for yourself first and foremost, and then secondly, for whichever loved one there is in your life that's going through something like this. And I'll remind people who, you know, come into the office and they'll talk about the headaches that they're having, their abdominal pain, and as they're walking out the door, the last thing they'll throw out there, and probably because there's a little bit of a hesitancy to bring up these issues and say, hey, you know, I've actually been struggling at work, or I've missed a lot of days of school because I've been feeling this way. And I rewind and I say, that's just as important as all the other things that you're talking about. Just like, you know, that headache is preventing you from going to work. If you're having mood issues or anxiety issues that are preventing you from going to work, you need to talk about that. And as healthcare providers, we understand, and I think we all need to be a little bit more comfortable and open and accepting of these conversations. We wouldn't expect somebody with a broken leg to be, you know, back at the cash register working with their cast on. We give them time and we allow for them to heal. And so the advocacy comes from your healthcare providers, but also in the workplace, also in the schools. There is a balance between, you know, we were talking about do sometimes people use this as an excuse? Because it is easy. It is easy potentially to look it up in the DSM. What are the diagnostic criteria? I've got that, tick, 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 because it's not in blood work. It's not something that you're going to find on a CT scan or anything like that. So there has to be a balance in our acceptance of these kinds of issues, and people have to know that part of the first step is the responsibility that you take on yourself, and the responsibility you take on to, you know, the child in your life, the adolescent, the elder person in your life that may be going through depression. So you need to bring it up with your doctor and bring it up as the reason for your visit. And that's where the ball, you know, that's where we get it started, because it's not a good enough excuse to say, well, the resources aren't out there, right? They are out there, but we do have to work together to pick the right resources for the right individual in the right case.
Yaseen, any last?
Yeah, I echo pretty much everything that she said. I mean, for the first person that has an individual that they care about, I mean, wish for yourself what you wish for others. I mean, there's just so many blessings in disguise for helping somebody who might be going through some catastrophe that we might not 100% agree on. And the fact that on our website, we actually have these steps that if you have a friend that you might be talking to and they're telling you not to tell anyone, this escalates. And if you know what's best for your friend, I mean, I'm not saying to go and tell on them, but either encourage them to talk to a professional or talk to the guidance counselors, or let's go together, support them, that, you know what, maybe they're just afraid. They want you to kind of go with them to the appointment. They're not at that level where they can talk to their parents. And the second individual that they're going through themselves, I mean, first of all, be patient. Know that there's just so many individuals out there, and the more we get to talk about it, the more we'll find out that this might be a normal thing, and we might be able to engage in conversation. And that leads to my third point, is conversation's a big thing, both going back to our creator and having a source, because, you know, we were given life, and at some points where we're still living, some people might think my life is taken away from me. We can get it back. It's mentioned in so many different narrations and so forth. So be patient, and have trust, and start talking to individuals, and with time and with professional help, I mean, there's always what do they say, light at the end of the tunnel.
This has been a wonderful, wonderful conversation. Thank you so much for coming on.
Thank you for
having us.
Hey YouTube, we hope you benefited from this video. If you liked it, or if you didn't, let us know in the comments below. And if you're interested in learning more, check out some of our other videos. And don't forget to subscribe so you can get new videos every Monday, Wednesday, and Friday.